So
Are you and Richard 6 feet apart there?
I don't know. I think
Okey dokey.
we
You
can do 6
don't
feet
want
apart.
somebody seeing you guys on the.
Let them fudge.
we are now live. It is now live. It is now live and they can hear you. So
Is there any reason why we can't go ahead and start with everybody here?
Yes. Yes.
I would let people get online.
Okay, that's right.
Then we're going to give them that announcement about texting and messages.
Exactly, okay.
and I did just put it on Facebook that we were going live with a link to the YouTube channel so that anybody who saw it on Facebook could link to the channel and
Can they comment?
yes.
Who sees it? I guess you would, right?
I will. If you have a smartphone, you could link to the channel and you could watch the live chat on your smartphone if you wanted. But yeah, anybody can see the live chat that's going on during the meeting.
I've been on several Zooms here lately. I just soon take a pointy stick in the eye. It's painful. How you doing, Jeff?
Good night.
So Jeannie, do they go up to our webpage to get to that web? You said YouTube.
It's on YouTube. Les has sent herself a link. She'll put it up on our website. And then I put a link on Facebook so that people would have a link to the YouTube channel. So they could find the live stream that way.
Okay. But they can get it off of our webpage.
Les has said she would be putting it on the website, so
Okay.
I believe her.
I believe it too. Okay, it's 5:30 p.m. And I am calling to order the regularly scheduled meeting of the Board of Health at 5:30 p.m. on May 11th. Welcome to all of you watching the meeting on live stream. And I understand you can get to it off the Worcester County Health Department webpage. And for those of you that may not have met everybody, we're going to start with Mr. Nat. Introduce yourself and go around the table.
Nat Sistrunk, resident of Belgrade, Dunham Township.
Richard Daniel.
Dr. Jeff Patey, resident of Marietta.
Bruce Kelbaugh, Decatur Township.
Jeff Jones, Walker Township.
Okay, at this point in time, normally in the agenda, we have a public forum which gives people an opportunity to address the board. And as I understand it on the live stream, there's a chat box where you can address this if you like. I'm going to give you a little bit of time to do that. Julie Farnsworth, our financial director, is monitoring that and she'll relay those to us. In the meantime, I'm going to go ahead and we're going to proceed with the approval of the agenda and the consent agenda. And then after we get those two things out of the way, we'll come back and see what we have as far as public forum. Is that okay, gentlemen? Okay. Let's see. Approval of the agenda. Do any of the members have any changes they would like to make to tonight's agenda as published? No. Okay, we're gonna do two. I'm gonna move the public forum till after the consent agenda, like I just said. And under new business, there's a line item that I'd like to add, which is dollars for accreditation and diabetes prevention. So is your motion to approve those suggestions?
I'll put forward the motion to approve.
Second.
Second.
All those in favor, signify by saying aye. Aye. Motion passed. Okay, the consent agenda. Board members, is there any item on the consent agenda you would like to have removed so we can discuss specifically? Start with Mr. Knapp.
You're speaking of the employee handbook portion,
No, the consent agenda.
the consent agenda?
The,
No, I don't have anything.
okay, Richard?
No.
Okay, Jeff?
No.
Okay, I'd like to move one thing from that, and that's the minutes for the April 13th, 2020 meeting. Is there a motion to approve that?
I'll make a motion.
Second?
Second.
All those in favor, signify by saying aye.
Aye.
Aye, okay. Okay, the consent agenda, which is minutes from the special meeting on April 7th, bills, Annex C, non-pharmaceutical interventions. Is there a motion to approve the consent agenda?
I'll make a motion to approve.
Second? Okay, I got a second. No, I guess we don't need discussion because it's consent agenda. Okay, all those in favor, signify by saying aye.
Aye.
Motion passed. Okay, it's now time to come back to the public forum and see if anyone has talked to Jeannie, chatted about any questions or addresses to the board.
There are no comments at this time. There are 4 other people logged in and watching, but it doesn't tell me who they are, so.
I'm on here on Facebook and I don't see the hook up to it. Just look, maybe I just.
You're on our Facebook page?
Yeah.
Okay, I'll double check
Refresh
that.
it, let me see if something changes.
Okay, 2 thank yous. One is to Lessa from the IT department for helping set up the live stream, and to Jeannie for helping with set up the live stream, and to Jeannie for the minutes last month. Thank you.
You're welcome.
Okay. So while we train Matt, we're going to move forward.
Nat, there's a big green, it's a W
Yeah.
with a green background.
Okay. As far as the public forum, I have been informed that no one has chatted yet. So we're going to move into the reports. And Roger, I'm going to start with you. And basically, you've included all of these reports in our package. But what I'd like you to do is give your administrative report. And then if there's any highlights out of these other ones, hit us. If there's not, we can ask questions and move on.
Correct.
So out of the picture is our administrator, with Mr. Roger Kaufman, and he paid a lot of money to make that happen.
Correct. We are very pleased with our new tobacco prevention coordinator, and that would be Brian Young. He is learning. It's a big program. It's a lot of work with the grant. So I appreciate the board approving to hire our new employee. And then the other part is headed into our June meeting, where we'll look more into the COVID money. And kind of an update for you, $65,000 will be coming into the 11 county regional PEP program that Crystal Early oversees. And that money can only go towards equipment such as aeroplanes, which cost around $14,000 each. And those aeroplanes that are purchased were a need that was shown on previous tabletop studies. And then they're shared with the 11 counties. So that's one part of COVID money that we received notice of award. The other notice of award is $78,688 to Washington County, which is split 2/3 to Washington County, 1/3 to the city of Marietta. And so we'll be transmitting $26,144 of COVID response funds to the city, and the county will retain $52,544 at this point in 2 awards from the state. So that's kind of what we're seeing coming down the pipeline from Ohio Department of Health coming from the federal money from Washington DC. And that will, later in this meeting, like Bruce is going to talk about our study of that in June. That's all I have.
Thank you, Roger. Questions for Mr. Kaufman?
The autoclave, where are they, cleaning?
The aeroclaves,
Airclave, I'm sorry.
that's where you're using a disinfectant compound. And then you're going out into an area. If they take it into a sanitary facility and they need to do several rooms, you go out with that disinfecting compound, which we cannot buy, by the way. So
You have the money, you can't get it.
it's not available.
You check with
We're
China.
looking 2 more weeks even to get some of the ones we have. But it would be used by each county in our 11 county emergency preparedness region to go do those types of projects.
But they would have an extended shelf life. I mean, they would be on hand in the future.
Correct.
There is one in the region right now, but Belmont County was hit harder than Washington, and they have it, it's portable. It's a portable unit that they can take around to wherever. They do squads. You can do an apartment, you can do residential facility. Yeah, it's just a portable disinfecting unit.
Okay, do any of the other members have questions specifically for any of these reports? Hopefully you had a chance to read them before. Okay, hearing no questions, we'll move on to old business. And Roger, you want to introduce the Kelly Miller contract and talk about that?
Yes, so we have a standard contract that is for 8 hours a week, $35 an hour. We are not going to need to utilize that contract for a few weeks because the restaurants are just starting to open back up. They'll be open for outdoor seating May 15th, indoor seating May 22nd. So we don't see a need for Kelly to be working right now and expending money out of that account, but we do need the contract lease so we have it ready when she is needed to come back in and start back into these restaurant inspections.
Okay. Thank you. Would you have a problem if we change the date from May 11th till August 31st and then,
I see us using them before then.
well, not before May 11th?
Oh, I'm sorry, you're talking only.
I'm talking about just going 3 months and then we'll check back into 3 months and do it again if we have to.
It would be smoother with us if we just do it the rest of the year, whatever the wishes of the board are.
The only question I have is Austin is an SIT, and it's my understanding that he was learning very quickly. Is he not going to be able to pick up some of the restaurant inspections, or we maybe not need her the entire year? I'm just asking.
There would be a mix of him doing the septic work that he's doing now. And depending on how that picks up, that would determine how many he'd be able to do after his training is completed as far as food. We just really don't know.
Okay. Well, if I remember right, the job offer was in 6 months, he was supposed to be able to do the environmental, septic tank, and inspections.
And then COVID-19 happened.
No, I
Really
understand.
upset the apple
But
cart.
just help me out with what he's doing in COVID-19, because he can't go out and do restaurant inspections. They've been doing a lot of septic tanks, I can see that, 12-month and write-ups and whatever.
He's doing a lot of soil tests,
Okay.
water will work. Yes.
Well, here's the thing, I don't mind the contract being for the rest of the year, but one of the stipulations was that she was going to train somebody to do electronic inspections, and that needs to be done before the end of the year, absolutely positively. Okay?
Yes.
Okay, so I'll entertain a motion to accept the contract as described by Mr. Kaufman, effective May 11th to December 31st, 2020. And if it's not in here, specifics about training, Washington County Health Department about doing electronic restaurant inspections. Okay, so Katie moved. Is there a second?
Second.
Discussion. Okay, hearing no discussion, all those in favor signify by saying aye. Aye. Motion passed. Okay, next one is revisit handwritten employee manual resolution. And if I remember right, we tabled this for 2 months. If I remember right, when we did this, it was passed 4-0. Nat was not here. You want to revisit it?
I think the biggest question I had, I just wanted to have a discussion about it. I'm not saying that we ought to change it or anything, but I wanted to at least have a discussion. One of the things, as I understood, that was part of that was, at the same time, was just deciding to not have staff come and represent in person. And in further discussion, my understanding was that you felt, or the group felt, that with Roger giving reports, that was adequate and gave us everything we needed. And then, the thing that brought it to my attention and kind of raised light on it was that virtually every meeting we've had since then, there have been times that we called on Jeannie to, for information that she had. So, I understand where we're coming from. I just wanted to make sure that everybody felt like that was the right decision. I understand cost savings, where it would have been billable hours. And I do understand the logic of Roger's reports and summaries. Do we feel like we're missing anything, or is this the right path to go with? This is maybe the question I'm throwing out there.
As a new member, I feel kind of share some of that concern. I would accept reassurance if there was some.
One of the underlying logics in that is that members quit work at 5 o'clock. We didn't have our meeting until 7 o'clock. And we were not reasonably assured that and of course, any time that they count is counted as overtime. It's comp time. So they get time to hang up for each amount of time. And in many cases, they would sit around for 2 hours in a meeting and maybe have 5 minutes of information, which may or may not have been influential at the time.
It's a valid point, Richard. I'm just broaching the issues just so we can talk it out.
Yeah.
Roger, do you feel like that there are gaps or things we're missing with the change, or do you feel like you're able to give us what we need?
We've had a unique situation the last 2 months, right, where Val and Jeannie have been essential to explain what's going on with this grant money, what's going on with the COVID response, and our risks in the community for COVID. And so we've had them here. And so, again, but that's unique, right, to our times this year in 2020.
If I could. Sure. I'm going to be very candid. I'm not trying to step on anybody's toes. Except for Richard here, you guys are all new on board, and you haven't seen everything that Richard and I have seen. In the past, in the small conference room, we would be outnumbered by health department employees telling us what we could and could not do. Okay. And that is not, while I appreciate guidance and there by the ways, Board of Health is a governing body for the health department. Okay. Now, I have already talked to Roger about for next month, I want to do a deep dive on finances. And I asked that Jeannie be here. Okay. And I think that's entirely appropriate. But I think it should be on a invitation only basis. And one of the things that I would consider, I don't know if Jeannie would do this or not, but if you feel like you need to be here every meeting, then we'll make sure that the finances are discussed from the meeting, and then you're able to leave. But if you work an hour, then you only work 39 hours that week. So the time you spend here would come off of your 40-hour week. I don't know if you're interested in entertaining that.
Considering that I haven't been able to get my work done in 40 hours a week for a long time, I don't know that it's going to make a whole lot of difference.
Okay.
Let me ask you this. Wasn't there talk that every meeting we're going to have a different person come in and give, like Josh was going to come and, I mean, I understand that was his time, but is that still the plan that each department,
Yeah.
or a different department will represent?
After we're past the 10 person limit,
Right.
and where we're at right now, the meetings must, there's no public gatherings over 10 people, so we can't really do that.
I mean, I just feel like at a minimum, it gives some personal connection to each department head so we can get a feel and a flavor of what's going on and
I'm
ask
talking
questions.
about continuing education.
Yeah, I mean,
That's gonna happen.
good, okay. Yeah, I mean, I think there needs to be contact with each department.
Yeah, COVID-19 kind
I
of
know, I
automatically,
agree with that.
but it was on the agenda, it just says no.
Okay.
So I think we're gonna proceed with that because I think it's good.
One other thing is Bruce and I attended several meetings of other health departments in the area.
Okay.
None of them had the employees there. The Board of Health is responsible and they made the decisions based upon the information that they had. There was not argument or discussion at the board meeting, tying up the public meeting in order to satisfy some quirk.
There weren't employees sitting around the table making comments under their breath about what we're doing.
Right.
Okay.
No, I take it all as down, and I'm not saying this, at this point, I don't have a problem with continuing with the current policy.
Okay. Well, then,
I just wanted to air it out and make sure we're all on the same page and understood what, what the pros and cons were.
well, we can do whatever we need to do to get the answers. So next month, I've asked Roger to invite Jeannie so he can do a deep dive in finances because of all this COVID stuff.
Okay.
We all need to understand that we can question her, but she can't stand.
And any board member can request somebody to be present. If we see an agenda item that looks complex or if we need more information. Or we come to you with that, or how would that?
Yeah, I think that should be a potential option, at least to approach it.
Well, here's the way it should happen, and it doesn't always happen. When you get the board packet, if you have questions, there's no reason why you can't address those to Roger, because we shouldn't be addressing specific employees.
Okay.
Roger's on one of the points there. Reports to us, but if you have questions, there's certain you can ask them beforehand.
Okay, fair enough. Okay. Good. All right. Thank you.
So we good?
Yep.
Okay, new, budget actions that needed under new business.
Correct.
You're man. Don't expect me to explain it.
There's several changes here needed for funds that are coming up, and I'm gonna let Jeannie explain how they came out of the different funds for refunds specifically for other things in the funds.
I had included in your board packet, I believe, a couple of explanations. Last month, we reduced the grant funding for the R Corp hub that was terminated. I forgot to appropriate the $30,000 that goes back to the general fund, so Kathy couldn't put it back in the general fund until we appropriated that. And I'd also reduced the appropriations by $125.68 that was on a purchase order encumbered from last year, which made us go negative, and she asked that we correct those two things.
You wanna handle them each as we go?
Okay, you just heard Jeannie's explanation for the fire R Corp. FS 2020-013. Is there a motion to adopt the following resolution, or her resolution? Okay, Matt moves in the second. Second. Jeff seconds, discussion. All those in favor signify by saying aye. Aye. Motion passed. Okay, second, Jenny?
The second one is in the general fund. There are two on it. One is the annual FAB, Public Health Accreditation Board fee of $5,600. That last year, when we did the budget in January, February, we weren't really aware of, and we forgot to add it back in at the beginning of this year. And then we also received notification of an unemployment claim by a former employee. I don't know the status of that. Kathy Tiemann and the lawyers or whoever handles the responses to that is handling that, but I wanted to appropriate $2,000 into that line item because if they find in favor of the former employee, I don't want to incur late fees by not having money available to at least get started on paying that claim.
Kathy, give me that number. I'm just curious.
The claim number?
No, it's 2,000.
No, she did not give me that number. I'm still waiting to hear about the claim.
Here's what she told me. We can't fight it. We're at a health department can. They're the only ones that can fight it. And she said it shouldn't cost us a lot of money, but she would let us know what we need to put in the budget. So if we put in too much, is that a problem?
If you put in too much and you don't use it, then you can just reduce it later and it just goes back into the unappropriated funds.
Okay, I don't have a
If I underestimated and we don't have the appropriations, that would be more of a problem. I wasn't sure of the timeline and I just pulled a number, honestly, about 1:30, 2 o'clock this afternoon. I just pulled a number out of the air because I was like, oh no, if they find in favor, we have nothing available to even start paying on that.
what Kathy says, that in government, they almost always get approved.
Mhm.
And she said, we can't fight it. But Marietta can, and if Marietta chooses to fight it, then we might not have to pay anything. But if you want to ask for the 2,000, that's what you're asking for.
That's what I'm asking for right now. If you think I'm underestimating, then you can increase it.
I don't know. Do you have an FS number that we can put there? Right there?
14 FS 2020-014.
Is this something that is a multiple claim that would hit Marietta as well as the county?
Well, here's what happened. It was an employee, his first name was Shay. And she was walked out of the building on administrative leave. She went to Marietta Health Department. And I've been told she was dismissed like that. She thought something. And I think you have to be somewhere for 6 months to be the employee of record. She wasn't up there long enough for that, so she's coming back on us. Kathy says we can't fight it, shouldn't be a bunch of money, so there's really nothing to do. She told me she'd give us a number to put in the budget, but if we want to go with 2,000, change it this one. Questions?
Was that a full-time employee?
Here?
Yes.
Yes. Okay, this is FS 2020-014, and Jenny just explained it. I did call Kathy. She said there's no reason for her to be here. So Jenny was $2,000 in the budget to be able to pay for that unemployment claim. And Kathy says in government, you almost always get approved. So, anything.
Sounds light to me.
Is that a one-time thing or is that a continuation, that down payment?
Does it go to 6 months?
I think it is 6 months, and here's the
$2
thing.
grand is not gonna be.
it was, the $2,000 wasn't intended to cover the total cost. It was an intention to have it
On hand,
on hand.
to
If-
do the initial, once we got the word.
Yes, and then once I found out what it would be total, then I could have brought the total amount to the board.
See, and that,
Can we put a $2,000 limit on?
No,
You might be able to. That's not the way it works with unemployment.
I mean, was this Shay, was she terminated?
not from our office, no.
Establish more.
She
Why
resigned,
give it to her?
she took a job in Meadow City,
Did she quit?
she notified us.
Mhm.
Well, I don't think she's eligible. She wouldn't be if you quit.
Well, she
Yeah, I mean,
she quit.
technically, I'm pretty sure Matt's right, she's ineligible, but she's gonna appeal it enough times, they'll eventually give it to her.
But
But momentarily, they gotta appeal like 3 times before they ever get it.
But, I mean, the health department funds through unemployment, right? You're sending unemployment taxes. This is like yourself.
we're self-insured.
Okay. My
We're,
mistake.
yeah,
So-
we're self-insured, so
Okay.
if there's a claim,
Right.
we have to have money in the budget to
But
pay it.
who's the deciding arbiter of claims? How does that work? It just goes to our attorney? Or-
I called Kathy and she has, there's somebody that the county goes through and I don't remember the name of the company that she said.
Kathy shared with me if it was, business, then we'd be out of the picture, we don't have to worry about it. She said, since it's government, we can't,
Well, if you, but
technically, we can't fight it.
do the same standards apply though? Is it 6 months? If so, $2,000 is not gonna cover.
Well, here's the thing that they just, the House and Senate passed one of those bills where you get $600, more unemployment a week, which she probably saw that, okay? But that should be federal money.
How long has she been gone? Or even from Marietta?
January, oh,
Oh.
it's been 3 weeks.
But she's just now getting around to it.
No,
She
the
just got
claims,
let go. Marietta.
the claim's been out there for a few weeks. I can't remember if it was right before or right after the last board meeting that I got paperwork and sent it on to Kathy.
But, you know, we can deny it, pretty sure, because she had a job when she left here.
Okay.
But I was not saying eventually through appeals, they might rule in her favor.
Well, that's the weird part though, is if we're self-insured, who is she appealing to?
I'm sure there's an unemployment commission.
So that's where it would go.
I don't know.
Yeah, the Ohio,
All I know is Kathy told me we cannot
It
fight.
should be the
She was-
same set of standards for everybody, where the limit comes from, should be different. I mean,
my understanding is because she
I've
wasn't,
dealt with this some, I'm pretty sure, you know, you can deny it.
well,
But that's business.
my
Different
under,
rules.
yeah, my understanding is that the reason it comes back on us is because she wasn't at Marietta long
You've
enough.
got so much time, they can come back on.
She
And-
wasn't with us long enough to be permanent.
She was with us
Maybe a year.
longer than 6 months. She was with us for about 7.5 months. And she had over 800 hours, 880, I think might be the limit. And she worked more than that because she was full-time employee. And 6 months is 1,040 hours.
Is that documented?
Yes.
Well, here's what I suggest. Kathy Keenan specifically told me we can't fight. Okay, so let's go ahead and talk about allocating this, and then you have to come back to us before you make any payments.
Well, if they say you have to pay it, I can't necessarily delay it to the
They
next
say we
board
have
meeting.
to, yeah, that's different.
Can you just shoot out an email to everybody?
I can let you know that we got an invoice, but delaying it would create fees and late fees and that kind of
Yeah,
thing.
that's not-
I will.
Until the next board meeting. when we discuss.
I-
So, yeah.
Okay,
That's what I'm saying.
FS 2020-14
Now I had it.
is a
And if you're-
resolution asking for $2,000 to go into the unemployment line item for a unemployment claim. And I need a motion if anybody's so inclined.
Motion approved.
Dr. Payton made the motion, is there a second?
I'll second it.
Matt seconded. Any further discussion, which we shouldn't have done until after the second, but we're good. I don't like it,
I know, I don't like it either,
but Kathy told me there's nothing we can do. And I believe it.
I would just ask if Jean could keep us in the loop as to how it's transpiring, you know, just so we can know. I appreciate
Kathy,
you.
we can talk to somebody, and get a good ruling on that, 'cause I'm pretty sure that's not the way it works. Yeah, otherwise it'd be two sets of standards for people.
Here's the thing, Kathy used to work in the business world, and she says HR is so different, and was not even me. She's the expert, I'm not. Okay, so,
Well, that begs the question, are we self-insured on everything?
no,
Okay.
we have.
Workers' comp, we prepay ahead of time. I'm not sure what exactly they
Who
call
does that
that.
go to? I mean, who's holding the funds? To go to the county or the state? Private
I-
company?
Again, Kathy tells me how much we owe and I break it out across the funds.
Are you talking about self-insured?
Your
I'm
workers'
sure the
comp.
commissioners have a line item for that that includes every organization in the county.
Okay, so it's all tied to the county.
Yes,
So somewhere there's a county fund that's holding money to
there's county line item.
Well, workers, but yeah,
it.
but
Do we pay into it like you do in private?
we pay
So,
into
okay.
workers' comp every year. It's an annual
But not unemployment?
prepaid, not unemployment,
So
no.
that's where we eat that. Okay.
See, here's what Kathy said. I keep quoting Kathy, that we needed to allocate in the budget where the dollar amount was going to be, and she was going to try to calculate that, so we're going to have to pay. We're self-insured,
Right.
but if we lose, we're going to have to pay.
Well, I guess I'm still just confused as to who makes the rule. I mean, who appeal you, does somebody appeal to? What board or official is making the call?
Okay, here's the thing, you want me to send Kathy an email telling her that, and copying each one of you that we need to understand the process?
I would like, I mean, if no more than just curiosity.
Future job and family services.
That's where the initial claims go to,
That's where everything makes.
job and family services.
So then somewhere there, or someone would go over that.
Okay, we
They make
understand.
a ruling, you can appeal it. You can do a written appeal, you can do a phone interview appeal.
So they go to the state level then? That's somebody there?
That's the website that everybody's been jumping on John Husted about not working very well.
Want your $1,200.
Yes, well, not, they're wanting their extra $600 a week.
Okay, we
That-
understand
that's
we're
one.
not authorizing any payment, all we're doing is budgeting money.
I
And
understand.
I understand there's a lot of questions, and I will address that with Kathy, copy each one.
I appreciate it. I just want to know more about it.
If we were talking about paying her right now, I'd have a hell of a lot of questions, okay? But we're not, we're just budgeting money. I think we had a motion and a second.
I say,
Correct.
Okay, further discussion. All those in favor, signify by saying aye. Motion passed. Jeannie, you will keep us in the loop, right?
thank you.
Chip, you have one more, Jeannie?
I have two more.
Two more, okay.
Number 16 is very simple. We needed to appropriate some money for a refund in the water. They paid for a water sample and then they didn't need it, so we didn't do it.
For a soil test, is that it?
No, for a water sample, just the drinking water. And I would like to budget enough to refund 2 water samples in case we come up with another one and they don't. Because if they pay us for it and we don't do it, if it's an overpayment, then we just refund it.
Okay, you want to include the Shane Purdue thing, we'll make it one motion.
We probably need to separate it because this is a roll call. And,
It's a roll call.
and
Is
this,
the Shane Purdue, there were two refunds. One of
Shane's the soil survey.
the soil survey is not, that's not what this is. This is money for a water
Oh,
sample.
I understand, they're both on here. I just didn't know if you wanted to combine them or not. They were both refunds.
This is just the budget to allow for it. And it would just put money in the line item that we would spend, we would pay back if you approve the refund.
Okay.
And if you don't approve the refund, then it would be there in case somebody else requested one.
So this is not a request for us to do the refund.
No, this is just to budget money into the refund line item, which we may or may not need after you look at this one, but we generally have one or two requests a year, and we only budgeted $50 in the refund line item at the beginning of the year. And a water sample is like 130, so it's $50 isn't enough to refund even one water sample.
That's the lesson learned. We should cover these items at the end of that.
Right.
Okay, FS 2016 private water system budget for a refund. Jeannie's asking for $260. Motion, I'm sorry,
I'll put for the motion.
second. Second. Okay, discussion. So this, are we gonna address this refund request tonight?
next,
Oh,
it's next on the list.
Okay.
I guess I got a question. On the soil survey, start with it. I mean, there's a reason it wasn't required.
Well, let's get into that on that motion.
Yeah, I got confused there.
Okay.
Hers is finance and then the fund request for blood bank.
I do have a question about this though. I guess I'm confused. You know, someone would come into the health department,
Mhm.
write a check, pay their fee.
Mhm.
Is there not a mechanism to be able to have a simple check and balance it? If it's due a refund, that the health department writes them a check and it doesn't have to go through all of this?
I don't, yes, and it says on the refund request form that if this is a simple overpayment, then it doesn't require board approval. But if there's been work done, or if there's some question about whether or not they are due back all of the refund or maybe a portion of the refund. But I can't write a check if there's not enough money appropriated. And I don't have enough money appropriated, so I'm asking for the additional appropriations.
I guess I just assumed that there would have been money to the account that people are paying into for the permits that they're.
But when I did the budget at the beginning of the year, I just did the $50 for
Okay.
not thinking of the fact that everything in there costs more than that now.
So next year you put 260 in.
Right.
Other questions? Okay, all these in favor, signify by saying aye. Aye. Motion passed.
I have one more, it's probably going to spark a lot of discussion because this should have been at your seat when you got there, or Roger would have passed it out. Sherry's been asking for this since the beginning of the year, but I was having some trouble getting some numbers to balance in the spreadsheet that I used to put year-to-year comparisons. At the end of 2018, we switched financial systems, and the 2018 grant funds spanned the year 2018 and then into the beginning of 2019 by the time we got everything liquidated and all of the money in. So I just want you to understand that Sherry's been asking this for many months, and it's taken me what I think is way too long to get this information available. The Creating Healthy Communities grant in 2018 went the way of many other grants and was 100% deliverable, which means that we do the work and then you get paid based on the job rather than just reimbursed for your expenses. And that means that at the end of the grant, there can be some money left over, and there was some question as to exactly how much was left over in the fund. And that was what we were having trouble figuring out. This sheet kind of explains on page 2 what the cash balance in there basically is made up of. The top chart shows how much the general fund has loaned that and how much of the cash balance actually belongs in the general fund. So at the end of the program or the project, that's how much money should be available to put back into the general fund. It's money that we technically can't spend. It's just operating capital. And then at the bottom, it's a comparison of the Creating How the Community's 18 and Creating How the Community's 19 grant, and the fund years are the columns. So it kind of gives an indication as to how much actual grant cash there should be available. If you take the CHC 18 and the CHC 19 totals and add them together, it's about $16,800 roughly. That would have been left over of the CHC 18 grant money that she earned during the deliverables period. And she's wanting to fund some projects out in the county using that money. And once that money is spent, it's gone. She can't do anything else with it. It won't be in the fund for operating. It'll just be gone, but it will benefit some of the people out in the county. She wants to buy a refrigerator for food commodities that are distributed by the RSVP program, Retired Senior Volunteers Program. We want to add some more signs to trails out in the county with a contract with the River Valley Mountain Bike Association. That's a partnership that we've had through that project, through that grant, since Court was the coordinator of it. And then some fitness supplies for Frontier Schools. And so that's what this last budget action is to appropriate the money for those things that she would like to see funded out of that leftover 2018 money that she got for deliverables and hadn't spent.
Okay, we couldn't use that money for operating expenses anyway, it's grant money.
Correct.
But there are potentially other projects that she could have proposed.
She could have proposed other projects. One of the things that the grant is requested to do is build a coalition of local partners. And I think that these are things that some of the local partners have asked for.
I agree with the program. It's a very good program. And I have confidence in Sherry making the appropriate choices with this one.
I'm just going to throw out that I have some hesitation with the Mountain Bike Association. I keep up with the news of what's happening in Athens County and some of the other things that's happened there. To put up signs, I'm not sure what the true payback or benefit is to the community.
Is that the Belfry? I know she's working on the Belfry part. That's not the Athens part of it, because she's not.
We're not in
She doesn't
Athens
get
County.
I'm just speaking of other issues I've seen, community-wide. It's sprung up, it becomes a bigger problem for you.
Can we get a motion in a second, and then if you want to amend this appropriation, then you could do that.
Okay, is there a motion, like Jamie said, to get it on the table so we can amend it if we want? I'll make the motion that we approve the $13,274.50 for the specific 3 items that Sherry listed. Is there a second? Okay, hearing none, it looks like the motion will die.
I'd like to have some discussion.
Okay, good.
I think it's just, to me, I don't know enough about this, the trailhead signs, 10 grand. Strikes me as, if she'd asked for 10 grand for the fitness supply for the school, absolutely, that sounds very reasonable. I just don't know enough to see if there's a justification for $10,000 to trail signs. I don't know. Would have liked to see something a little more descriptive, just to kind of know what's actually being done with it.
Right, more of a justification or even a presentation.
Something like, I'm not a hard no about it, I just would, and again, it's an easy understanding fitness supply from the schools.
Mhm.
Yeah, give them some money, I'm cool with that. But
Roger, can you bring it to the next meeting and we'll tackle that right up front?
Yes.
One thing I just noticed, which I don't like, that's not for signs, that's for a contract. Right, for somebody else to install, right?
Right, that's part of my, I mean, if they're an association, I assume they're volunteers. We're gonna pay volunteers, well, they're not volunteers anymore.
Okay, I'm gonna try another motion. Motion to approve the $1,500 refrigerator for community food distributed by the retired senior volunteer program, and $1,774.50 for fitness supplies for Frontier Schools.
I'll make the motions.
Second. Okay, motion made by Nat, seconded by Richard. Discussion.
Just cross the other one off on the motion. Yeah, perfect.
I'd just like to know more about it. And maybe there are some other projects they want to bring as alternatives.
Or like you mentioned, though, we're not limiting ourselves to not funding this, another one more, right?
Right. I mean, we could really put 10 grand towards schools, couldn't we? Yeah.
Okay, you're running 2 other programs, and you're taking the money from
Just
4 programs.
Cross that off. And
Away from it, you could run 4 programs.
so this one
with
was,
the same dollars in that 10,000.
I think every question that's been expressed is fair. Okay, so Roger's gonna bring her to the next meeting and she'll address this right up front.
That'd be right.
And so that's these 2.
Okay. Okay, motion FS 2020-015 for creating healthy communities is simply for supplies for $1,774.50 and equipment for $1,500. And we had a motion and a second. We had discussion, and the young lady's going to address it next month's meeting. All those in favor signify by saying aye. Aye. Motion passed. Okay. Who has the invoice for county on? You.
I do not have it.
I think we're more making you aware that there is an invoice audit coming.
Is that for last year or this year?
I saw it.
Because last year we cried, Health Commissioner cried, we didn't have enough money, we might talk to you at the end of the year, so I don't know if that's for this upcoming audit or the 2 years.
They are audited every year, so it would be for this year's audit.
Ballpark, how much was it?
I can't remember if it was 23 or 3,200.
Okay.
It was,
You scared me, I thought it was gonna be another 0.
no,
Okay, that's just an FYI, is what I hear you saying.
yes.
Thank you.
We'll probably come back next month with do you want us to pay this? And if so, we'll have to appropriate money.
Okay. We're up to the refund request.
Yes. So James Purdue, this is a $150 refund request for a soil survey. The application was made where a series of fees was paid on April 20th, 2020, and it included $150 for a soil test. Well, after the check was deposited, we saw that very quickly, that a private soil scientist did a soil test that is valid in 2007. So there's no need to redo the soil test. And the person applied for that soil test and error. So the 2007 is valid, and we're simply correcting the different amounts you paid. $504 for permit fee, $150 for system design, and $20 operation and maintenance fee. So the 824, we did not need the $150 for the soil survey.
Since no time and material was used to do that, then I'll move that the refund be approved.
Second.
Okay, it's been moved and seconded that we approve the refund. Discussion. All those in favor signify by saying aye. Aye. Motion passed.
All right, and then the water sample refund for the Millers. It turns out that 2 months ago, based on an alteration permit, the property had a water sample that was satisfactory. And being only 2 months old, it is still valid. And so this new request for a possible property sale was not needed. No work was done. And we're requesting to refund $130.
Motion to approve.
Motion to approve.
Second.
Okay, motion made and seconded. Discussion. All those in favor signify by saying aye. Aye. Okay, motion passed. I added one thing in there, Roger, the new business. And my question is based on the employee sheet that you gave us. Oh, the accreditation, diabetes prevention, that's an open position. I know accreditation gets paid out of general. Correct?
I believe that's correct.
Okay. Now, diabetes prevention was the PACS program, which Behavioral Health Board took back. That's not correct? Okay, that was the school program, PACS. Okay, but there was a diabetes program.
That was through the Curating Healthy Communities grant.
Oh, it was?
I'm pretty sure the diabetes program that we had.
Well, my question is,
What was it for?
The DPP program was initially part of the Communities Preventing Chronic Disease, which was the contract we had with Athens.
right,
And we don't currently have a DPP program,
right,
although Sherry is a master trainer and has been she's been sought out by different places in West Virginia to come and train trainers for the program.
okay, here's my question. Accreditation is paid out of the general fund.
Yes,
Okay. The diabetes prevention, is that going to be paid out of Creating Healthy Communities?
it is not, no, it can't be, because it's not an approved program under the Creating Healthy Communities, and because she does it in West Virginia, not Ohio. We get paid, in the past, the way that's worked is we've paid her to go do the programs out of the general fund, and then they reimburse us, and that goes back into the general fund.
So is that what would happen? Are you saying Sherry would do that? People in West Virginia would pay her?
No, they pay us. She doesn't want to do it on her own time for whatever reason.
Okay.
So in the past, it was permitted for her to do this. And she's done this through WVU, she's done this through Marshall, she's been to Huntington. And she goes, we pay for her time. Sometimes we'll pay for her travel, sometimes they provide her travel or her hotel and meals. And then we invoice them and they reimburse us. Sometimes I would prefer it be a flat fee, but however much we spent on that, they reimburse us. And a couple times we've been able to take a little bit of an admin fee on top of, not a lot, but
So did those hours come out with Creating Healthy Community 40 hours?
she doesn't work 40 hours a week. And those hours were paid out of the general fund. And then the money that we got reimbursed went back into the general fund for those hours.
They cover what went out.
Yes,
Does she-
sometimes a
she
little
work
bit more. She wants to do this,
She doesn't want to do it over. But she's only working part-time here.
right? She works 30,
32.
between 30 and 35 hours a week, yeah.
So she just doesn't work the extra hours.
She probably didn't want to do the paperwork as a contractor.
Well, as a contract, there's probably liability involved, and if
Yeah.
she's doing it as our employee, and her husband is a lawyer, so they probably talked about it, and if we give her permission and she's doing it as a health department employee,
So going to those additional hours would go to that, and she's okay with that.
like I said, in the past, she's done this in the past. And the hours that she spent, the days that she spent, we paid those out of the general fund. And then the reimbursement went back into the general fund. And it was always enough to cover the cost of that, and sometimes a little bit more to cover the cost of invoicing.
Okay, I'm gonna ask that position not be offered to anybody until we get some more detail on it. Because obviously she can't do the accreditation. Okay, and the accreditation, we've talked about a grant writer combination, so I'd just like to have some more discussion before we offer that job to anybody.
Correct.
Is that okay?
Yes.
You guys agree?
Do we have a date for accreditation and inspection?
They extended it 90 days for March 23rd in general,
June 23rd.
but with COVID-19, all bets are off. When anything will start back up again, specifically with that.
Just wait till the murder court gets in.
Where do we stand in relationship to that inspection?
We're in good standing. We have all our documents submitted, and we're simply in a holding pattern until a date can be established that they can safely do a site visit.
Have you been able to get into the site and look at the documents? Have you been taking advantage of
You mean
that?
all 49 pages of them?
All 4,900 pages of them? Yeah, because that's going to be the biggest challenge, is making sure that everybody's familiar with the documentation. And what little I did know before COVID-19, it's probably buried back in there somewhere still. But that's going to be the challenge, is being familiar with all the documentation.
Follow-up question. Where do we stand on the move of the office?
My opinion on that, the commissioners who are coming in January of 2021 have one view of it. The two commissioners who will no longer be here in January 2021 have a different view of it. And I have deep concerns because they would not fund the changes that we needed to operate as required by the state of Ohio as a health department for our vital statistics, for our nursing. They promised, but when it came down to doing it, those promises were not fulfilled.
How much are we talking dollar-wise?
It is unknown if they draw up plans for that building, what those costs would be from engineering through completion of remodeling in that building. We were never given a number because we never settled on an actual plan that we could actually talk, black and white, what they could change for us.
But the incoming members seem to give you hope that they will proceed.
It appears that the way the health department was handled in this was not satisfactory to the residents of Washington County. Forcing a move residents don't want to go anywhere but where the health department is currently at to receive services on Muskegon Drive. There seems to be a groundswell about that in the community about what was done and what investments the health department already has in a good facility on Muskegon Drive.
Okay, I'm gonna take exception to that because when our insurance guy from Columbus came down, he told the court that the building we have is the most unsecured health department we've ever seen. So my point of view is we'll address that down the road.
Secured house now.
Unsecured,
Being like, from that.
too many doors, too many unsecured whatever. So, it's a fair question. It will be addressed down the road.
Does this board need to deal with that before accreditation?
Well, here are the priorities that I see: COVID-19, accreditation, and then the move. But I intend to address that with the commissioners and see what their feelings are, because I haven't talked to them in 3 months. Okay,
You're asking about addressing with FAB. That's what your question was, Richard.
did I miss the question?
Asking about what?
Is your question, would FAB have problems with our current facility because it's unsecure, or is that the general area where you need information?
Well, I'm just trying to move this along and kind of get it off the table. It's been dragging, the move has been dragging since we started talking about it in September.
I would say that several years ago, when FAB started, you had to have a gold-plated facility. And a lot of money was spent to make gold-plated facilities. But in southeastern Ohio, we do not have gold-plated facilities. Noble County does not, and was able to navigate the accreditation process through their site visit. And there was a lot less focus on the building. The focus was on the programs and the people, not the building this much.
Can we pass that sort of inspection?
They told us, even if at Gilman, we didn't have all the facilities we need, they would deal with that in 3 years on our re-accreditation. There was not going to be an issue they were going to make with the facility.
My view is that the move probably has not a lot to do with accreditation. I think we'll be okay in accreditation. I think the move is making sure that we're positioned for the next 20 years, okay? But we're not gonna resolve that tonight. Stay tuned.
I'll admit I'm a little in the dark as to some of the details with the new building. And what's
Okay, well, I'll get you an update. Okay. Let's see here. So Jeannie's gonna come next month and we're gonna do a deep dive on finances. So
Yes.
you guys have all your questions ready, okay? Look through those documents ahead of time. If you have questions for somebody, address them to Roger.
That's a great suggestion.
And what I want to do is pass out the county performance appraisal that all the Washington County employees get. It doesn't include us. I talked to Kathy Tillman. I think we should be consistent, and what she provided me, I thought was a very good draft. So all this is for you to look at. And we'll talk about it next month. And Roger just got me a copy. Here's a copy of what we have. It's only 2 pages, so I'm gonna make copies and scan it and email it to everybody so you have the current one. So that's just fine. Okay? Any other business? Hearing no business, meeting adjourned. Thank you, everybody. I think there's something you want more detail on. I mean, we'll try to